Well, I'm delighted to welcome back to the show someone who came on, oh gosh, a long time ago, really, in the early days in the different format. But it is the Chief Executive Officer, the CEO of Medigold, a very important national company based here in the county. And it is a big welcome to Alex Goldsmith. Alex, welcome to the show. Nice to have you back on. I guess the last few months have been very interesting for you.
Yeah, thanks, Adrian. Thanks so very much for having me. Yeah, they've been, look, like I'm sure many businesses and many people throughout the UK, they have been interesting would be one way of looking at it. Challenging, exciting, different, all of those things. COVID has obviously presented my industry, which is health and well-being, with a number of challenges, but also a number of opportunities. And we're very much, we're a very relevant industry currently with everything that coronavirus and is throwing at the country and the world. So I think it's probably thrown up a bit more relevance and a bit more frontline attention for the health and wellness industry, which isn't necessarily a bad thing.
Yeah.
But certainly, yeah. But going back to March last year, it was an absolute. It hit us as hard as every other industry and or every other company, and we lost in the region of 50% of our revenues almost overnight in March/April. And yes, we had to be very agile and try and work very hard to recover from that.
Wow, that's a big drop. Now, just tell us what Medigold does exactly, so everybody understands. Is it a product? Is it a service? How do you engage with your customers?
Absolutely. Sorry, I should have started with that. Medigold is what used to be called an occupational health provider. Now we would call ourselves more an employee well-being provider or service. So we effectively will contract with employers of all shapes and sizes across the country to work with them to ensure that their people are in work safe and well. So they're able to participate in work. They're able to do it, notwithstanding any health issues they may have. And we give advice and guidance and products and services to all employers and how to make sure that they've got the best possible solutions for their people and they've got the best chance of having their people active and in work.
And this is physical and mental well-being, yes?
Absolutely, so the full spectrum. So we do everything really from a workplace wellness perspective. So, I'll just try and list a few of them, but we do employee medicals, we do flu jabs, we do pre-employment screening, we do sickness absence referrals, we do health surveillance and statutory screening for people who are in jobs where there's lots of noise or vibration or other hazards in the job that would mean that they might need regular statutory testing. We do lots of mental health support. We do lots of health promotion, lots of training, lots of nutrition advice, physiotherapy, counseling. You can kind of get the picture here. We do the whole spectrum of anything to do with being healthy at work.
So the companies pay you a sort of insurance fee, I guess. Then you offer services like training, but I guess also when people have a need, then you say, oh, we'll send this specialist to come and see your employee, something like that.
Yeah, so it's a varied model. So most, in fact, of our income is a sort of fee for pay-as-you-go, basically, pay-as-you-go kind of service. So people will order, some services and then we'll invoice them afterwards. And that could be, we employ in the region of, I think it's over 70 occupational health physicians, which are effectively doctors, and in the region of 150 occupational health advisors, which are actually nurses. And then we've got other screening nurses on top of that. We've also got technicians who go out and take the testing that I described earlier, both from I should also mention, we do a full alcohol and drug screening service as well for testing people for the effects of alcohol and drugs. And we have lots of technicians out in the country doing that and our health surveillance work. So most of our income is from fee for service, as I said. Some customers will pay us a fixed fee, the sort of all-you-can-eat kind of model where they'll pay a fixed fee and use us as much or as little as they need. And some of the SME customers that we work with do work on a kind of an AA membership, AA motor membership, as it were, that style of membership where they will pay us a kind of annual premium and we will provide service as and when required and kind of on a kind of a as-you-need basis.
Okay, that's very clear. Thank you very much for that. Is this driven by a necessity to do so, to buy your services by law, or is it something that companies do voluntarily?
Well, it's a good question. I would love to think that businesses would just want to make sure their staff were healthy, irrespective of the law. There's this question that you just asked actually could have an hour-long answer to it, so I'll try and keep it brief. But basically, there is laws when it comes to health and well-being, mainly around the statutory stuff I mentioned. Around if you're an employer and you place people in harm's way or potentially in harm's way as a result of doing their job, you have a duty of care as per HSE guidelines for making sure that people are being tested regularly. For instance, if you've got people regularly using drills in the road, you have a duty of care to make sure that they're not getting, hand-arm vibration syndrome or white finger as a result of doing that work. So every periodically, we will come in and do a medical and some testing to make sure that they're in the job and they're being safe. So that would be the law side of it.
Yeah.
Really, the most of what we do, though, probably 85 and 90% of the income we get is from companies just wanting to do the right thing and wanting to make sure their staff are supported. And health and wellness is something that has been a tick box for many years, honestly, in terms of company strategy. It's something people felt they kind of should do, but to kind of tick the box, literally, but actually, honestly, no one really cared. If I'm being sort of, well, that's a bit generalistic. I'm sure lots of people did care, but there wasn't a real push from businesses to look at it until probably 10 years ago, at which point it started to become a lot more relevant, and people realised actually from a purely, from a productivity point of view, it makes total sense to have a workforce engaged and fit and healthy, right? So businesses started to realize through better statistics from businesses like mine that they could really drive productivity through improved workforce health, which then really started to drive investment. Now, because of COVID, we're now talking, whereas only 5 years ago would have been an agenda item near the bottom of the board agenda as a topic. Our industry now, health and wellness, on most businesses' agendas is number 1, 2, or 3 on the boardroom agenda, alongside financials, is the health and the wellness of the workforce. And that's not because of the law, that's because people have realized the real good that it does.
Well, yeah, that sounds very, very positive for you and your industry. Who is the buyer then? Is it the chief executive officer? Is it the finance guy? Or is it HR? Who normally makes the decision or sort of signs the contract?
Well, so the most senior sort of a user would normally be the HR director, because typically in businesses, the people person is the he or she that will normally be the sort of top stakeholder. That being said, in recent years, we have seen more and more CEOs and CFOs and finance directors getting involved in what we do, because for the reasons I've just described, which is they can now see the real metrics behind improving the health of the workforce. Mostly, though, I'd say still we work with the head of HR or on some occasions the head of health and safety.
And do you offer a service of lots of data, as you say, so they can see, a sort of macro, big picture view of what's happening with their employees?
Yeah, that's the real game changer recently. I mean, we're one of the companies that worked very hard on producing some really quite good statistics on everything that we do that drills down into quite a lot of detail. So businesses can actually now take those statistics and really mold their strategy for health and wellness around the numbers they're seeing. So it's not a one size fits all. Many businesses have different types of people doing different types of job with different types of pressures. And so what we will do is come in, work with the business for a number of months, produce some pretty good stats, and then mold what we do around those stats.
It's really very, very interesting. So the last 12 months then, with COVID, which is a physical disease, plus a lot of mental health problems, you say that you lost sort of 50% of your revenues, but how has the business adapted, and how has it adapted to the very specific needs of the current kind of crisis?
Yeah, thanks, Adrian. I say we lost the revenues. What I should probably have said is we lost them temporarily. They fell away purely because a lot of what we do, as I said, is doctors and nurses in clinics seeing people and giving advice on how they can do their job. And so 2 things. One is, if we can't physically see people because we shouldn't be seeing them because of social distancing initially and when everything got closed, then clearly that's a problem. Secondly, if people haven't got people at work because they've all been furloughed and they've shut their businesses down and whole industries have closed down, then obviously a lot of our customers didn't have the requirement, for a lot of the stuff that we normally provide. Yeah. Having said that, it did gradually recover throughout 2020. to the point that by the time we got to November 2020, we're back up to sort of normal levels of revenue. But what we also did is, I'm very proud of the business. We've got a great bunch of people at Medigold who, I'm very lucky in having them, and I could talk to you for hours about the merits of having a good team as a CEO. I do think that, no matter how good you are or good you could be as a CEO, you're nothing without a team. And what COVID has shown me more than anything else is that I'm an incredibly lucky man to have the team behind me that I do. And they all, to a man and to a woman, totally got behind everything that I asked them to do in terms of thinking outside the box, trying to find ways of coming up with COVID-related products that could help customers in a very, very quick fashion. Normally, it takes months and months to design and implement a product and bring it to market. We did it in days. And so we did lots of COVID support questionnaires. We had lots of advice to businesses on how to make their offices COVID safe from a health point of view. We had lots of COVID risk assessments going out. We had COVID mental health questionnaires to ask people how they were feeling and giving customers ideas on how to cope with people's mental anxiety as a result of COVID. We started a nationwide provision of COVID testing quite early on. So we were doing that from sort of August last year, when many others took a lot longer to get going. We're now still doing that, and I think we're the largest COVID testing entity in the county. I'm pretty sure, certainly from the private sector, obviously not bigger than the NHS. But we are, from a private sector point of view, I think doing the most tests in Northamptonshire certainly, and one of the most compared to the private sector companies around the UK. We also pivoted and provided there was a lot of very dodgy PPE flying around various customers, and you'll remember when the pandemic was at its height. I think there was a lot of missold PPE and a lot of dangerous things going around that really shouldn't have been, and a lot of chances of taking advantage of the very inflated prices. We deliberately sourced some very ethically sound PPE, actually from another very good Northamptonshire-based company, Full Support, and we made sure that the PPE was spot on and provided a lot of our customers with some safe PPE that was better than the stuff they were being offered from some of their other suppliers, which they were very grateful for. And we also established all sorts of very ingenuity, lots of very clever ways for customers to keep in contact with us. And we ran toolbox talks and mental health sessions and sort of just catch-ups really for customers to understand how they were doing, which they appreciated. So we managed to soldier on and really transform our business into something quite different, which I'm sure many businesses managed to do, but I'm particularly proud that we did it so seamlessly and so quickly.
Yeah, no, that's a great story. And I've heard a lot of people have come on the show and said that, innovation has the agility and the speed of how businesses have responded. But I guess working on adrenaline all year too, which, you can only go so far. So what are the main lessons, Alex, you take forward, really? And hopefully towards the end of this year, COVID has receded or we're managing it. What are the main lessons in terms of running your business that you can carry forward?
So I think there's a few real clear things that will be here forever that should stay. One is the idea that I think businesses in general, mine certainly, was often very reluctant to make change. And even if businesses do make change, it's often very protracted, and you have to really, really have the utterly convincing statistics in order to then have the courage to make the change. And there was a number of things that my business had been trying to change at certain levels for a number of years that we hadn't quite done, that effectively COVID shoved compulsorily straight down our throats, and which we had to accept, but which we then saw, had we done so earlier, we would have been a better business. So I'm talking about the way we have offices, the way we offer remote working, the way we offer flexibility to our staff, the way we communicate to our staff in a more regular and meaningful way. Communication for me has been a real eye-opener. I've always felt as a CEO that I'm quite open, but I've utterly transformed the way I speak with and to my staff. We've obviously been through a period of huge uncertainty, and we had to go to our staff and ask for enormous sacrifices in certain cases to be able to keep the business going throughout midway through last year. And they all did it without question, and they trusted us to get it right. And in return for that trust, we shared all the information we were receiving, good and bad, good news and bad news in terms of the numbers, with everybody, which they massively appreciated. And it's created a much closer bond between the employees and the management team. And now we have regular social events on Zoom, regular communications, regular formal stuff to tell them what's going on, where we have open question and answers without any screening of the questions. We just take the questions and answer them on the spot. And it's completely changed the relationship I have with the team, which I love. So that's probably the biggest thing.
That's fascinating and very, thank you for being so very frank and honest about it. So communication, collaboration, compassion in many ways, and trust, of course, which I think, again, we've had to trust our employees far more, right? And rather than watching the clock and seeing them in the office, they're working remotely, delivering.
Yeah. Well, trust is a two-way street, isn't it, Adrian? And I think that we've seen that both ways. And I think, the people have trusted the management teams to make the right calls and ensure businesses can continue. And then by the same token, the management teams can trust their people to get on and do their work in a different environment. And absolutely, I think it's been I think the other thing that's changed actually after COVID is I just hope the world will be a kinder place, in all honesty. And when we say empathy, kindness, it's very obvious that to get through this, business owners and business leaders and people in, just employees in business have had to be a lot more tolerant with their colleagues and with their suppliers and with their customers. I've even seen customers that in the past might have been trickier to deal with, showing real understanding and patience, whereas before there may have been less. And that's just, for me, that makes the world a much nicer place to be in and work, doesn't it? I mean, the whole idea around seeing people in their home environment on Zoom, not worrying if someone's kids run into the back of the Zoom and start tugging on mummy's hair. Really, who cares? At this point, it's kind of funny. It's nice to see them in their home environment. I just think the whole world's become, the whole separation between home life and work life, which used to be sort of what you were one person at work and another person at home. I think that's all been massively changed, all for the better, because why not just be yourself at work? Surely you'll get the best out of people if they can just be themselves. So do
you think these changes are widespread, and do you think they will stick? Because we're seeing a lot of coverage of this thing. People are caring, this compassion and collaboration that you're talking about. Is it widespread, Alex, in your experience in the contacts and businesses? And is it going to stick once life gets back to normal, or will we go back to the old, ruthless dog eat dog kind of approach?
I mean, I think sadly the answer is probably there'll be some retrenchment, because that's just the world we live in. But I think, if I'm being ever the optimist, I can tell you that my business certainly feels that a lot of that stuff's going to stay, purely because I think we'll be a more successful business. Not purely, obviously there's human reasons, but cynically, I think businesses will see they're just going to be better places to be if they do keep some of this stuff. So that hopefully will mean that it does stay and that we don't cynically retrench back to something a bit more draconian. I think the world, from speaking to other business leaders, which I do reasonably regularly on various forums, everybody seems to have a similar view. I've spoken to very few, I've spoken to a couple who have this view, but very few that think it'll all go completely back and businesses will just sit in offices again and there'll be no flexible working and there'll be no, and the compassion that we're seeing as a result of the pandemic will retreat. I'd like to believe that's not the case, and I think we're in for a very different world. And I'll tell you the other reason why I think that's true is that we already had, with the new millennial generation, a shift in what was important to them and what motivates that generation of people. So I'm 45, so at the end of the day, I'm nearer the end of my career than the beginning, or certainly nearer the middle if I'm being really optimistic. But the people that I've met in their 30s and the 20s are motivated by trust, by compassion, by empathy, by sharing knowledge, by feeling that they can rise up an organization through their abilities and their skills and knowing things quicker maybe than they used to be able to do, because it was rite of passage kind of way of managing. And I think that was already the case before COVID, and I think there are a lot of businesses struggling with that. And I think what COVID's done is really accelerate the thinking process around those concepts to something a bit more tolerant and actually a bit more embracing. So I think, and bearing in mind, those people are going to be running the companies in 10 years anyway, or less. So that will naturally mean that I think there'll be a desire to keep this shift in the way of working.
Well, I like and share your positive attitude. So let's just talk a little bit about the there's a national Build Back Better campaign. You know that I've been sort of beating this drum in the last few months here in the county. You've been a big supporter, Alex. Tell us a little bit about corporate, social responsibility then, and in the wider sense, right? Not just our people, but people and environment, and the community in which we're operating. What do you think is happening there, and what's Medigold doing about that sort of non-financial and perhaps longer-term issues as against short-term, maximizing profit?
Right. So I think this comes back to my thoughts on this. I went to a seminar 2 or 3 years ago by a chap called John Blakey, who's written a book called The Trusted Executive. And he has a very interesting hypothesis on what trust can do in business and how there should be a sort of triple bottom line of people, profit, planet, rather than just profit. And his book is centered all around that type of premise. And he really did hit a chord with me, because I personally have long thought that the best way to run a business is through trust and sharing information. But I think what I hadn't understood is the wider angles of what trust can produce and how a business can behave to really get the sort of trustometer on to 10, as it were. And that really does mean doing things and acting in a way that's not just about the way you communicate with your own people, but the way you communicate with the outside world, and the efforts that you make to lead by example when it comes to doing the right thing. And we've so long been keen on doing lots of sponsorships and lots of social enterprise stuff in terms of giving money and resource to communities in which we work and live. So my staff will always come to me for things like sponsoring football teams, under 11 rugby teams, ballet troops, dance troops, street dance troops, the local Cub Scouts. We sponsored the UK bobsled team for the last few years because they had their sporting funding cancelled by UK Sport, even though we were 4th in the world, which I thought was crazy. We sponsor lots of really sort of causes where I feel that either there's a good story behind it, or it helps boost the community within which Medigold lives and works. So that we were already doing that, and then what that occurred to me after that was that we need to formalize that more, and we need to put some more meat onto the bones of how we interact, not just within the communities, but how what our environmental footprint is, what our our commitments to diversity and inclusion, lots of things that I think we can work on that I don't think we're bad at, but we could be better at. So we've really embraced that type, and I think it really fits, honestly, Adrian, with the whole concept of how the world is changing and how things are becoming important to businesses that weren't before. And the thing that occurs to me is the world is moving in this direction. Finally, the needle has moved. And do I want Medigold to be one of the sheep following the crowd because I begrudgingly feel I should do, because that's what a tender document tells me? Or do I want to do it because I actually want Medigold to be the kind of business that my father started it as in 1998, and I've continued to run it as subsequently, which is at the forefront of everything we do, trying to do things properly, and it's certainly the latter. So that's why we're looking at all sorts of things regarding what is now known as ESG rather than just CSR, and are trying very much to improve ourselves every day on that.
Well, that's a great testimony to this whole movement, and I think you're absolutely on the money, really. The tide is turning in favor of these things, and this ESG, or environment, social and governance, is less about what you do. It's how you measure, monitor and report on what you do. So, how easy is it to do that? Does it fit with marketing or finance, and how easy is it to get data on these issues?
Yeah, so I think that's a very good point. I think that's the process. That's where we're at now in the process. As I said, I think we've been doing good things for a number of years, but probably because we didn't do those things for any kind of, gain or any kind of surreptitious motives. We did them because it was the right thing to do. We probably didn't actually document them like we should have, and we certainly didn't, record or gain from them. But actually now I think the point is the ESG movement means that keeping proper record of these things, yes, also enables you to tell the world that you are a proper employer that does things, in this certain way, which, there should be some governance around that. Otherwise everyone could do it. But also it means we are, the good news is it means we are going to get some, I suppose, credit and benefit from all the good things we are doing. So we're on that journey now. We've employed someone on a 3-day-a-week basis to solely do this, so become effectively our head of ESG for Medigold. That's a step forward, because I think in the past we've had various senior executives doing things, but obviously then, for want of a better word, inverted commas, the day job comes and gets in the way, and then ESG gets a little bit parked on the back seat. And we obviously don't want that to happen. So now I've put in a dedicated person to Jane to look after this stuff. on a full-time, well, I said on a fully employed basis. She works 3 days a week at the moment, but I'd imagine that will increase at some point, and I'd imagine she will be getting team members quite soon. And so she's going through a process of going to every department in the business and effectively discussing with our teams how we interact, how we affect the environment, how we affect our social surroundings, and how we govern it. And she's documenting all the things that we do now, and we're working towards an accreditation called B Corp, which is one of a number of different options for the world, sort of the way you sort of score or get accredited in this type of venture. B Corp we chose because I'd been to a seminar and seen it. Again, it was one of the ones related to the trusted executive I talked about, but and we chose that one because we think it's a good one globally. We think it's got good credit, good points surrounding it. And we're going through that process now to try and see if we can gain B Corp accreditation. And part of that is as I said, Jane gathering the information. Some of it's quite easy, and so if you're doing stuff already, it's easy to document. Some of it is a bit sort of you're doing some of the right stuff, but you're going to have to do it better and in a slightly different way, with a slightly more accuracy and focus on capturing data. And some of it's completely new to us, and we'll be starting it from scratch. So it's kind of got the full ends of the spectrum there.
Well, it is a journey, that's for sure. I think, unashamedly, why not benefit from the halo effect, the reputational effect? But I think the challenge is to get the impact assessments, which is what B Corp do, right? Get the impact assessment, understand the numbers, and then I'm sure it's easier to, like with any investment, you're talking about your social return on investment. If we do this, if we do A, we might turn £1 into £4 of social benefit, but if we do B, we might turn £1 into £8 of social benefit. So I think that's the way the world seems to be moving. Businesses like certainty, but they also like numbers, don't they? If you can measure it, you can manage it.
Yeah, and I think that's the bit that was missing. And we've got a good heart as a business, we know that, but we didn't know the size of it because we haven't measured it. So I think it's a bit, using the analogy, you're a good person, you're fit, but you don't know how fit you are until you start wearing Apple Watches and all sorts of stuff tells you on your iPhone these days. And I think it is a bit like that. And I think it's nice to have, to be honest, for me, as the CEO of Medigold, I know that we've been a good business for a number of years and we do the right thing. So I've never had a problem with being worried about that we're not doing the right thing. But I think what this gives me is the extra level of commitment and reassurance that not only are we doing it, but we can do it now in a more consistent way, in a way that we can tell our people about, because obviously the stats that we will generate from doing B Corp, we can share internally. And it'll just give a lot more structure to it, which I think, it can only be a good thing.
No, very much so. Well, Alex, you're on radio. Hopefully you'll make the following commitment, but from my perspective, you're one of several companies that are doing some really interesting stuff. Each of you's got something different. There's lots of pieces of the jigsaw puzzle. I think each of you can learn from each other, but I hope I can count on your continued support for this Build Back Better in the county. Let's get our businesses raising the bar all round. Let's get more Queen's Award for industry. Let's get more badges, these third-party recognition. But let's make our businesses better, stronger, more resilient, and better places for people to work and live in.
Yeah, 100%, Adrian. I couldn't agree more. And you do have my support. And furthermore, we're in an industry, health and well-being, which I started this interview with. We're very much in that space. We want businesses to be using us to help their businesses to be stronger and fitter and healthier and do all the right things. And so, first of all, I want that to be the case because obviously it'll help grow my business. And secondly, just as equally, I want the world to be a nicer place for people to work in. And I know that I've got a 9-year-old daughter. I've just brought her up, through this pandemic in the last 18 months, homeschool and everything else. And I want the world that she ends up being able to be let loose into to be a nicer place than maybe the one that we entered COVID into. So that's the aim, isn't it?
I think that's a great sentiment to end on. So build back better for a better world. Alex Goldsmith, Chief Executive Officer, CEO of Medigold. Thank you ever so much for coming on the show. Keep up the great work. Keep safe, of course. And I look forward to working with you on the Build Back Better Northamptonshire campaign. Many thanks, Alex.
Thanks, Adrian. Thanks a lot. See you soon.